Today is 31st of August 2023. This is the
11-year-old male,
Lhasa Apso.
not neutered, Lhasa Apso. Lhasa Apso. He had a history of a big skin lump, right?
Yes.
About how many centimeter?
It's about 5 cm
Times.
and 3 cm.
Yeah, and you can see from the video that was before operation, and the lump is really discharging. Like, is it discharging? Discharging some pus, because over 2 years the dog had been licking it, and so it becomes very badly infected. Inside you can't see, so the smell is all over the body, right? So it came here 4 days ago, right? So
3 days ago.
3 days ago.
Monday.
It was operated under anesthetic, and I think okay, take out the phone. You can see that the stitches are healing very well actually. So if you want them bathed for another 7 days, that means 10 days. It is very strong already, the stitch. But if you are really desperate, then put a plaster, a waterproof plaster over the wound,
Okay.
and then the groomer, you won't bite the groomer, right?
Same groomer for 10 years now.
Then tell the groomer don't avoid that area, don't rub under the area, then put him in a bathtub.
Okay.
The groomer in the bathtub, right?
No, she showers.
Okay, shower it, and as long as the part is covered,
Okay.
waterproof, I don't know those type of waterproof. And normally the groomer showers on the top of the table, or
She usually takes him inside. I never see her.
okay, but if you can wait, so much better. Or then these stitches are dissolvable, so you should dissolve, but it takes 21 days to a month. So e-collar will be on. Antibiotics how many days?
So far, I think 1 week worth is there. Yeah.
Appetite is good, right? You say
Appetite is same. It's not really reduced. As in, his appetite is less than what it was 2 months. 2 months ago, appetite started dropping. And then, but he was not, like I told you, he was not eating his kibble. But if I make him sausages, like our food, he'll gobble it up.
Oh yeah.
His own food, he won't. He just stopped eating.
It becomes juicy.
Yeah, became very choosy.
So do you take any blood tests? None.
Done.
Huh?
Yeah.
What's your blood test?
From the other clinic, I gave it.
What did you say? Any white cell, total white cell?
It's like this mostly okay.
Okay, yeah. So the thing is, you within 3 months, if you see no more swelling, then of course it's not cancerous. But there are cases where if it's a very malignant one, the swelling comes back within 1 month. And the thing is that I would advise, because some owners they don't know, don't wait. If you see a swelling, come over, and then I would cut a big margin, because normally the cancer cells are at the margin, although it's removed, but at the margins, there are cells. This tumor normally we don't remove a bigger cut. Especially
there was a 1 cm margin taken this time. Yeah.
There is,
Yeah.
Okay.
That's why it's not really. He did a wider one. Wider.
Yeah. Okay. So if that one is sufficient, then of course it's okay.
Yeah, but he did tell me that if it comes back along the margins, then we just excise once more and see. Because I don't want to. And that's the reason why I chose not to send the histo, because you're not going to give him chemo or anything like that.
Yeah, correct.
He's already 11. His bleed is usually.
This type of dog can live up to 16, no? So I mean, he looks okay.
Yeah, he's quite healthy otherwise.
He doesn't have liver or lung or kidney disease or heart disease, right? No. But anyway, many of the dogs they live up to 15 at least. The small breeds in Singapore. And this fellow, I would suspect that I would expect him to live up to 15 to 20, depending on his health, the heart, the lungs, and the kidney. So No, as far as the teeth is concerned, there's no bad breath, is it?
No, it's always been the same. It's not that his breath has become any smellier.
No breath. The breath.
Breathless, huh?
Breath.
No, not really. No.
Smelly. Bad breath.
No,
No.
not really. It's not any worse than it normally is.
But if you want his teeth to last until old age, that is the best to have one scaling done. At least, I mean, it may last 2 or 3 years.
Okay.
But then at last time he was eating dry food, so that's why his tartar is not that bad from what I see. Yeah. But it's not easy to see because you didn't manage to lift up the upper lip far to the back. And so I would advise one dental
Scaling.
after all this. But if not, then what happens is maybe 2 years down the road, it starts to loosen.
Okay.
No, because of the tartar, the inflammation, then it loosens, and then it becomes toothless. I mean, over time lah. But if you can clean up, then at least you won't get gingivitis. Then it will last long. But they need the teeth to grind, especially the back teeth. Okay, so far so good. So about 7 days more, then stitch removal. Okay, then can go home, Maria. That's good.